Hi, I'm Dr. Sylvestre with Focus and Flourish. I've had a number of people request that I do a video on bandaging complications. So in this video, we're going to talk about how to avoid those complications. First, I'll describe the complication, and then I'll describe how they occur and how to avoid them. If you ask Google what some of the more common bandage complications are, you're going to see things like skin irritation and dermatitis. And I would add to that interdigital dermatitis. These actually can occur pretty commonly with either a poorly applied bandage or a bandage that has gotten wet. We can also see wounds as well as decubitus sores. So this is beyond dermatitis. This is an actual wound where the skin is broken and sometimes we'll see bones sticking out. The decubitus sores especially can be a significant problem. So we certainly want to avoid these. Distal edema and swelling is when you see the toes that are sticking out at the bottom of the bandage that start to swell. And they swell for a few reasons. One, maybe the bandage is on too tight, or two, maybe we have too many toes that are exposed. And therefore, even just a bit of tension on the bandage, it causes the blood flow in those exposed toes to be more sluggish, and therefore the toes swell. Now, if the bandage is removed, the swelling goes down, and this doesn't have to be a more complicated problem than that. However, if it's not managed, you can end up with ischemic necrosis, and that's when the blood just stops to flow to the area. And yes, body parts will fall off. The picture on your right, that dog just lost a few toes, but the one on your left, the dog lost its entire leg because there was just nothing flowing. So leg falls off is a very uncommon problem, but it can occur. And that's why we need good bandage care and follow-up. So bandage slippage, which never seems to be considered a complication, but in my mind is, if the bandage slips and it's still on the leg, but it has fallen down, it means that it's really not fulfilling its function. Maybe the pet has a splinted bandage because it has a fracture. And if the bandage slips and the splint moves around, that fracture is not going to heal very well, right? So delayed healing means more bandaging for a longer period of time. Nobody wants that. In order to avoid some of these complications, we need to understand how and why they occur, and therefore what we can do about them. Bandage complications that occur from the construction of the bandage can be put into two different categories. And the first category would be the layers, and the second one would be the application of the layers. One of the common problems is the layers are placed in the wrong order, or maybe a layer is missing altogether, or just there's so little of it that it might as well be missing. In order to avoid placing the layers in the wrong order, you need to know what the order is. The layers always go in this very same order, and never should this order be changed. You start with the cotton padding or the cast padding. It offers the padding to the bandage, clearly. This layer after that is the cling layer or the gauze layer. That's the layer where the tension is applied, and it will therefore give form to your bandage. It's a really important layer. After the gauze cling layer, you apply the vet wrap or the cohesive bandage layer. And that's the layer that protects the bandage. It's a little bit water resistant, and it will keep some of the dirt out of the bandage. Now, if there's a wound, you may want to have a contact layer. So first, the contact layer, that could be a telfa pad. It could be a wet to dry gauze kind of layer. It could be a hydrogel, whatever structure you like. That is the contact layer. And it goes right against the wound, then the cast padding, then the cling gauze, then the cohesive vet wrap layer. And if you have a splint, the splint always goes in between the compressive layer, so in between the cling gauze layer and the vet wrap layer. Now you may want to use another layer of cling to hold the splint in place. That's fine, but your functional cling layer has already been applied. This next one's just holding everything in place. And never should this order change. Now, applying the bandage properly is also really important. Probably one of the bigger issues is that there are too many toes exposed distally. And therefore, we have a lack of venous return. Because of that, the bandage doesn't allow the proper blood flow to all that tissue. So we get poor venous return and the toes swell. So the way to clearly avoid that is not to have too many toes sticking out. The picture that's there, you can very well see the third and fourth digits are protruding enough that we can see them, but not so much that there's going to be a lack of venous return. This, I will admit, is a part of bandaging. The experience helps. So it is important to monitor the bandages. And if you're new at this and if you've just placed a bandage, maybe don't let the pet leave the hospital immediately. Watch it for even the first 30 minutes, 60 minutes. And if those toes are going to swell, you'll probably start to get an inkling of that, and you can make the adjustment as necessary. I have a video that's called Starting a Bandage, and it is a technique that is really helpful for getting those two toes cradled but exposed, that allows you not to have the distal edema problem showing with the bandage. And therefore, why not just cover those toes? Why have any exposed at all? Because you might end up with this distal edema issue. Those two toes are a great barometer as to how well your bandage is doing and how well your patient is doing with the bandage. If there's a change in the pressure or the tension over time, you will see those toes swell. Knowing that is crucial information so that an adjustment can be made in a timely fashion. So it is important, it is preferable to leave two toes exposed, but no more than that. The next issue that we can have is too much tension applied to the bandage. Now we know that the gauze cling layer is your tension layer. It is uncommon to have too much tension applied if you've put enough padding underneath. So if you did not use any padding, or if you skimped on the padding, then yes, it is possible to apply too much tension and therefore end up with a ischemic necrosis problem. The best way to remedy that is add padding. The more padding you have, the more tension you can apply without concerns. Too much tension, although it feels and can be a really big problem, it is the least common complication of a well-applied bandage. Now, not applying enough tension to a bandage is also a problem. And it's probably a lot more common because people are afraid of causing ischemic necrosis, maybe not understanding that if you have enough padding, that's really not likely to happen. So they tend to not apply enough tension. And the worst thing really that's going to happen if you haven't applied enough tension to a bandage is that the bandage will slip down. And if it's doing that, It's just really not doing its job. So you may not be creating any issues, but you're not solving any issues. You're not effectively treating your patient. If a bandage is applied maybe a little too hastily without a lot of forethought, you might get some bunching in the material, the cast padding especially, and that sometimes can cause some pressure points, I'm going to say, inside the bandage, just enough to make the patient uncomfortable. And bunching of the bandage is more likely to happen also if the gauze layer, the tension layer, is applied too loosely, so nothing is being held in place. Poor monitoring and poor follow-ups are a huge contributor to complications going from something small, something mild, to something really bad. Now, if a client doesn't properly manage or monitor their pet at home and they allow the bandage to get wet, that's the beginning of problems. Skin irritation leads to dermatitis. Dermatitis is uncomfortable. The dog starts to chew, and so forth and so forth. And that will need to be managed. But the truth is, the monitoring and the follow-ups appointments are what's going to prevent any small problems that are beginning from becoming big complications. So a rubbing issue of a bandage that might be trying to create a decubitus sore can be prevented if at the follow-up bandage change, it's noticed and something is done about how the bandage is applied. If the client notices that the toes are starting to swell and they don't call you, now we're going from distal edema to potential ischemic necrosis. Bandage monitoring by the client and proper follow-up care when it comes to bandage changes are probably your biggest, most important components in preventing complications. The truth is, one day we'll apply the very best bandage, and the next day, maybe it's not as good of a bandage. A well-educated client is going to pick that up and bring the pet back into you so that we don't end up with a horrible complication. Just an annoying, pesky bandage change. All right. Yes, they're annoying, they're frustrating, but they're better than dealing with a complication. I hope you found this video helpful. Please hit the like button and subscribe to our channel.